Today we're going to give you some highlights and evaluation from our 2021 cohort of nurses in primary care that completed the care programme. And we'll give our 2022-23 offer of availability for our wider primary care and community colleagues. Next slide, please. So as a quick introduction to our primary care workforce transformation team, I'm Leslie Royal Pryor, Primary and Community Nurse Lead for Greater Manchester. My colleagues on the team are Dr. Nikesh Vallabh, who is the Primary Care Workforce Clinical Lead, and the programme leads who will be joining me today are Kerry Porter and Jonathan Henderson. Next slide, please. So a brief overview of today then. So throughout our presentation and discussion today, we aim to discuss what actually the care programme is, how it started in Greater Manchester in 2020 and how it's progressing. We'll give some highlights and evaluation of our amazing 2021 nursing cohort, discussing the individual benefits with nurse testimonials endorsing the programme as well. We'll discuss the wider outcomes and benefits from the programme and how the impact of the quality improvement projects that they're doing or have done are supporting population health across Greater Manchester. From this, we'll discuss just why it's important for us to replicate the programme across the wider primary care team and why it's needed both personally and professionally for us individuals. Then we'll have time, like Sophie said at the end, for some questions. Next slide, please. So, CARE, what does it stand for? It stands for connected, authentic, resilient and empowered. These are words that you'll hear all the way through this presentation today. So just keep them at the back of your mind there. In 2017, the Chief Nursing Officer for England launched Leading Change, Adding Value. This national framework for nurses supported colleagues, whatever their role, to lead, influence and innovate, enabling nurses to understand the importance of measuring outcomes of work and ensuring quality and compassion in practice. In the same year, the Chief Nursing Officer launched the GPN 10-point plan. This recognised and developed nursing roles that transformed care in general practice. Aiming to meet the general practice workforce challenges by recruitment and retention and returning to practice, the plan set out work to increase the focus on personalised care in the community with a strong focus on prevention and population health to drive better outcomes and experiences for our patients. Not only did that, it was doing that, but it wanted to raise the profile of this highly skilled workforce of general practice nurses and highlighting the leadership potential of all the nursing workforce to lead change, improve quality and compassion in practice. And here in Greater Manchester, we wanted to build on this and to extend this leadership. Next slide, please. So here's the lovely Carol Jarvis, and she's showing her lovely care programme badge here. Carol was one of our participants on the cohort. So what is it? So again, CARE is connected, authentic, resilient and empowered. It's designed to develop leaders by building on leadership skills, personal resilience, self-awareness, health and well-being and empowerment. And here in GM, we took up the offer of the care programme for our nurses in primary care to ensure fair access to leadership programmes, to extend our leadership roles, to support existing and potential general practice nurse leaders for the future, and to create potential by empowering and amplifying the nursing voice in general practice. Next slide, please. So here's some lovely faces of who took part and who were leading our programmes throughout the 12 weeks of the course. So what were our aims and intentions? Well, with the dedication and involvement of the NAPC team, that's the National Association of Primary Care, and our workforce team at Greater Manchester, and in conjunction and collaboration with GP Excellence team and support of nurse leaders across Greater Manchester, our intention was to empower confidence, raise the confidence, inspire and develop nurse leaders in each of our 67 primary care networks across Greater Manchester. That was our aim. So we aim to empower them with the skills and confidence to lead change. However, that wasn't to happen. The COVID pandemic, the mass vaccination campaign, and all other things of added system pressures altered our initial aspirations to not actually achieving 67 PCN nurse leads. However, what was achieved by our 42 nurses that took part during such a difficult time was absolutely unbelievable, and is a testament to those nurses across primary care in general practice in Greater Manchester. For us as a team, we couldn't be prouder of the achievements of our nursing colleagues throughout and beyond the programme, and a testament of their dedication, belief and courage you'll see today. Next slide, please.
Sorry, I'm just going to stop sharing just for 1 second, and then I will come on and continue, young Leslie. Right, if everyone can see that now. Is that okay? Yeah. Yeah, brilliant. Right, okay, yeah. So like Leslie said, and I was going to do a bit of an introduction, is that obviously primary care is already a very, very busy environment, already under pressure. Then along came the pandemic, and I think more than ever we needed to support our workforce and give them the skills and equip them with the skills so they could achieve their ultimate goal, if you like. So just going into the aims of the care programme that we had, so obviously we wanted to work with the NAPC to develop and implement a leadership programme for our GPN nurses. We felt like this was a skill that was required, a skill that not only helps you deal with the current pressures, but helps you plan and strategically view a bit of see light at the end of the tunnel, if you like. So we definitely wanted something around leadership. Plus, leadership is a very generic training exercise, if you like, and it goes across any disciplines. However, we did want to concentrate on the GPN nurses for this time period. And as we go into later on, obviously our next cohort is very different around the care programme. We also wanted to develop a lead nurse for each of the 67 PCNs in Greater Manchester. This not only this helps connect the system, it helps build a network, it helps lessons learned. So we really wanted to build them networks and get 67 of our nurses on this course, as Leslie explained. We wanted to build confidence and support our GPN nurses in leadership and also in health and well-being as well, which obviously the care programme does support your health and well-being. It's split into two, so you do have your leadership and development, and you also have your health and well-being and looking after yourself to make yourself responsible for yourself, which is a really good start to any leadership programme. So it really, really enforces that health and well-being, especially as the time that we're in and the current time we were in last year, really hard position to be in. We wanted to add value to services and promote quality, and the way we did this is that the care programme has a project-based focus at the end of the programme to give experience of leadership and to increase that population health in the communities with a positive outcome, which also then reinforces that leadership, that support, that confidence within the candidate through the work that they've done. So yeah, we'll be talking a bit more about that later on. Opportunities for GPNs to make a difference and become influential in developing their PCN. PCNs are a very in their immature state, if you like, and they are still being built up within the system as a PCN. So what we wanted to do is really support that, and by giving that influential person, that extra leader within the system, especially towards our nurses who are a massive part of the primary care system. And as you'll find out later on, what we wanted to do is give them a voice within the system. We also wanted part of the aims and initiatives of GM was in regards to the BME representation. So we also wanted to support diversity on the programme. And this is something from our own lessons learned that we'll be supporting on all future programmes from primary care. And obviously, I'll give an update on the next slide around the representation we got from BME, which was really, really positive. And we wanted to give something back to our GPN nurses who've worked harder than ever. And as Leslie said, through the pandemic, it's just been an added layer of icing on a really, really thick cake that we've already been chewing our way through. It's been a real hard time for everybody in the system. And like I say, with our GPN nurses at the front line, we had the vaccinations and extra responsibilities that were coming on they really have worked supremely hard, and we just wanted to give them the skills and confidence and give them something back. So at the bottom, we just wanted to highlight as well that we have obviously the primary care as a people plan. That is our strategic direction. That is the way we want to change, the way we want to work. So the care program really fits into this strategic view, if you like. So growing and training the workforce. So yes, we're growing and training our workforce through this leadership program. They're belonging to the GM health and care system. So this is the part around, again, the networking in the system, that we've become an ICS. That's the change in our environment. We're becoming a single unit, if you like, to work together. So this really does promote that networking, promote that collaboration. Looking after our people, this is another thing. So we wanted to look after our staff. We wanted to give them skills that would help them support their own health and well-being, their own leadership support, give them confidence to push through the barriers that they'd never had before, which again, further on in a slide, we'll see some feedback from the candidates that really prove this. But not even just looking after our people within staff, this also is looking after our people in the community. And again, going back to the project-based focus and the outcomes of the project, which we'll go through later on, really does work a lot across the board in community, not only in our organisations, but in the community as well. And it's a new ways of working. So we want to be collaborative. We want to be networking. We want to be working together. We want to be sharing lessons learned. We want to see what you did well over there, what can we bring over here. So this is what the care program and the underbody really does underlie our principles of the people's plan. So come on. Yep. So what were the statistics? What were the outcomes? What did we achieve on the course? So we had 60% of candidates filled. So we wanted 67, and that aligned with our PCNs. We ended up with 42, but we did have 4 drop out, and they were through reasons, uncontrollable reasons, really uncontrollable reasons. So we, like Leslie said, I think our aim was 67, but if we remember where we were at the time with the pandemic and all the different things that go around a pandemic, for time not being in work, etc., we did really well. And there was one thing that really pushed this forward that we did slightly different than I've done in any program in the NHS before, is that we went a bit more personalized with the comms throughout. So we started in the January going out with the comms, and by I think it was February, March, we were going out to individual practices, individual people. We were trying to get the expressions of interest in so we could have a more of an informal chat with those candidates, just to make sure that they were confident that they were the right person for coming on the course, and that we really did support them in the fact of we realized how busy it was out there, and email comms sometimes just don't break the barriers. So we really did put maximum, and Leslie put maximum effort into reaching out to our candidates, and it really did work really well. So while we were doing that, is we got on our first cohort, we got 11 nurses, our second cohort we got 12, and then our third we got 15. So it did start to increase towards the end as we were starting going out with personal comms. So out of them we got 36 GPNs, we got 1 social care nurse, we got a community nurse. Out of that, we've got 6 BME nurses, which we achieved 14.3% of our candidates for BME nurses, which was 10% aim. So that was fantastic that we had that representation. Unfortunately, we had all female nurses. Now, I don't know if that's unfortunately or fortunately, but we were stretching out to try and get some male nurses. However, we are doing programs to kind of support the data that we receive within primary care at this moment in time, to really support so we can start going out and targeting areas of GM. So unfortunately we didn't get any males on the course. So out of that we got 29 PCNs, so we got 33% of PCNs on board. From that we got 9 CCGs. We did have 10 out of 10 CCGs, however we did have a candidate who had to leave as well and go for a new a new position, I think it was, that couldn't continue, which did drop Berry off our CCG list. So we were 100% on CCGs, and then we got 90% on CCGs. So you can tell that we did branch out into Greater Manchester, and this was a Greater Manchester system that we were trying to promote. So a bit of lessons learned is we were in the middle of a pandemic. This was a very, very difficult period of time to run any course and get attendances. Like I say, all the nurses were really, really busy, either working through the pandemic and other things, and as well as vaccinating and extra roles and responsibilities during that. So we did really well to get the candidates. We had a full risk register during the project, so we highlighted any risks. COVID was one of the main ones, obviously, and the surrounding areas of COVID. Lessons learned, our right project group, we had a fantastic project group for the care programme. Everybody was willing to support us, everybody went out of the way. When we did the personal comms, we had one of our lead nurses who accompanied Leslie to interview people and them informals, and it was all late nights or 6-7 o'clock in own time, that kind of stuff. So really good group, really wanted this to work, could see the benefits of the care programme. We had all representation in that group, so we had all levels of representation, from nurse, workforce leads, obviously ourselves as planners. So we really did have a good representation out in GM. We did offer backfill for candidates. However, we did find that we had 8 claims, so that we've thought that might be a bit of a pump primer, a bit of a persuasion to get our candidates on, that we could backfill. However, once we started to go with the personal interviews, the interest started to come, and it wasn't so much about the claims and the backfill as actually getting on the course, which was fantastic, and the learning. Communications, so communications again, we pushed out into the system in all different forms, through Twitter, I think we were on Facebook, we did emails to the system, then we branched out and went through all the meetings in Greater Manchester that we normally do, workforce leads to operational groups, presenting around the care programme to really advertise it out there. And then we went did our personal comms as well. So really some lessons learned there around not only COVID, but in a normal situation, on how we can change the way we work from our side, especially around communications. So what were the outcomes of the programme? So from the candidates' learning outcomes, we wanted to ask the candidates, we wanted it on a 5-graded level. So whether you thought your skills, if you like, had declined a little or a lot, had stayed the same, improved a little or improved a lot. Now, obviously with a programme of work and with training, you really want to avoid the decline a little, decline a lot, or else there is no value to that training. So what we found out from our responses, which we had 69% returns from our candidates, which is quite a real high response rate. We found that every one of their skills, when we asked them, had improved or stayed the same. But if you look at the stayed the same and improved, the percentages in the improved a little and a lot were huge compared to staying the same, which was fantastic, to be honest. That's what we were looking for. Now, we found that obviously the questions we asked is, we wanted to know if your leadership skills have increased, we wanted to know if your job satisfaction had increased, and you can see here that some of these results were really spectacular, almost 50% on each one, which was brilliant. The one thing that I didn't really account for was the clinical skills, because I thought, well, as a leadership course, it's not really concentrated on clinical skills. However, what we did realise then is, through their projects within the system, then their clinical skills, and as you'll see later on with our varied projects from all over, is that their clinical skills, through their learning development, through their own personal research to get these programmes off the ground, clinical skills had increased, and had increased quite well, to be honest. So there's another few interesting things, and this came back on the feedback as well, that the voices had been heard. So people were feeling like the voices weren't heard as a nurse, and once they'd gone on the leadership programme, it gave them the confidence and skills, and really started to make their voice heard, that they could put ideas into practice, that obviously, again, we'll see in the feedback, that relationships have increased around the system, around GM, confidence as a leader has increased, and that they feel like they're making a difference. And these, you know, you're influencing skills, you're influencing staff you work with, and sometimes this can even just narrate down to your attitude. And I think that when you get people into a motivated, positive attitude, that really comes across on influencing skills. And what we had from the candidates, and every candidate was on course, and going back to Leslie's slide where we're all smiling on the course, I think every candidate we had was absolutely superb and really did put effort into this course to get something out of it. So really fantastic results, and really positive that we found that so many people had improved within their jobs and their roles through this leadership course. So what were the outcomes from the candidates personally? So relationship wise, we found that most people, or everybody that returned, had improved a relationship. Now there's a lot on that had improved up to 10, 12 relationships around their networks, and these were from relationships with other nurses in the system, relationships with providers, relationships with the NHSE and other organisations. We found that they were not only with other nurses around Greater Manchester, but with other professionals, so with GPs, with MDT meetings. We found that not only have their relationships increased, but they were running primary care networks or a part of their primary care network meetings now, and managed to get onto their primary care network meetings. And there's something that's really special around relationships. And the last feedback that we got really was the one that really touched me in a way, is that they said that the relationships within the wider nursing team and PCNs as well, so they'd increase that relationship as well as meeting new friends on the cohort. And I love the word friends, because I know we use the word colleagues a lot, and I think colleagues is a bit more professional word, but I think when you meet friends and people who think the same, and especially around your own profession, makes you feel confident yourself in that way. So it was really good that they built these relationships up, and they're continuing to build these relationships. And like I say, this wasn't just in their own PCNs, these were across PCNs. This was a collaboration approach, which is what one of our original aims and achievements were, to collaborate around Greater Manchester and build these networks and peer support. So fantastic feedback on relationships, and the impact on the candidate as well. It was just really positive. And just to pick some words out of this is that we had, you know, it was excellent, and my I can do mentality. So I have a can do mentality. I've just not managed to switch that button on. However, it has improved. It is coming on. The fact of, I mean, this tells you where primary care must have been during our pandemic, is that the word anxiety, which is quite a strong word, and especially for those of us that have felt anxiety, and especially within our jobs. And I think you feel anxiety in your job if you have a lot of passion for your job. And with this feedback, it really shines through. That obviously that's reduced, and she feels able to manage the winter onslaught on its way. So there's planning there, so they're thinking ahead, they're starting to plan, and that leadership really does start to enforce that you can do it and you can be the planner. So we're using like that leadership with experience. We had that it's reignited someone's passion, that it was mind-blowing and a whirlwind of opportunities with massive changes, and it's increased their confidence. Their motivations increased, and they're happy, they're more happy in themselves because they feel like they can make changes. The stepping away from comfort zone, I think we all have our comfort zones, and I think this really from this candidate is that they're accepting challenges now, and they want to move forward and work in a more positive way, and they can see the change, but not only within themselves but with either surrounding colleagues or out in the community through their program or their projects. And the last one is that it's helped to gain a bit of the spark back, and I love that comment, because these are realistic comments. A bit of the spark back. Why did you get into nursing in the first place? And I think we did have that, a lot of that conversation on the care program, that people had lost that kind of spark of, they knew where they were, they knew why they were getting, but sometimes they've just been in a place for so long they didn't know how to step over and get out of that place. So it really did ignite that spark and passion to continue in their work and to be better and bolder. which is fantastic, really good feedback. And we did have an impact on employers. However, obviously this was COVID, it was really difficult. I've said that we went out to personal interviews with our candidates. Unfortunately, we couldn't do that with all the employers, all the practices. We did send out our feedback. We got 5% reply, which is low, and that is granted. But the replies that we got were really, really positive, and they mirrored the candidates' replies. So it was that they'd seen their candidate with a mass amount of confidence and self-awareness, that they're more confident to take on other training, that they're very enthusiastic and have the confidence to lead on small projects within the PCN, so they could be more value within that PCN and take on more projects and programs or more work that the practices or PCNs wanted to do. They could see a planning an activity in their staff now and looking at their systems, and patients have benefited, and that was another thing. The community patients have benefited from the small projects that the nurses are doing, and that's exactly what we wanted from this program, that it is a beneficial program throughout the entire system. So I'd just like to take a pause, if you like, and just introduce you to a few of our nurse candidates that were on the course. So this young lady, Jennifer Crozier, she's a complex care sister. She's been in primary care since 2020, and she works at Stalybridge, Duncanfield and Moseley. So I'm just going to let Jennifer talk to you about what the care programme's done for her.
Hello, my name's Jennifer Crozier. I took part in the care programme. I'm trying to explain to you a little bit about what it is and what it meant to me. I had certain expectations of the care programme. I thought it was just another leadership course that I would do and gain some more information and some more development, but it was much more than that for me. I've managed to meet some wonderful people, some inspirational leaders that have taught me quite a lot along this journey, and they teach you to look after yourself, to be empowered, to inspire others, to care. It's a really good course that focuses on self. One thing I got from the course was that it actually affirmed what I felt a leadership style should be, so that you are allowed to have care and compassion, and you don't have to distance yourself. It definitely is something that's done a lot for me. My career has actually, in my eyes, catapulted since doing this course. I seem to have had the courage and confidence to go above and beyond. Some of the things that I've managed to do since being on the course, and it may not be just because of the course, but it's definitely given me more confidence and courage to do it. I've wrote 2 articles that have been published in nursing journals, one in the Nursing Practice Journal and one in the British Journal of Nurses. That was definitely a career high for me. I've been able to speak at the GM Primary Care Awards in front of quite a lot of people and influential people, and do a presentation to express what I've done as part of the course, which again was a massive career high, and I'm really pleased that I was able to do that. I've had some situations, I've come across emergency situations actually out of work. So whilst I was on holiday abroad, a young child, 5-year-old, was taken out of the pool, and he was very limp and he'd drowned, he wasn't breathing, he wasn't alive. I took the initiative to go over there to immediately assess this child and to commence CPR. It was very emotional, very gut-wrenching, but the child did survive and come back to life, and you know, I think I had the confidence to lead that situation, so it definitely impacted me, part of the course for that actual situation. The other things I've managed to do, there's too many to mention. I put myself out there now, and I go for my goals and I go for what I want to do. I think more recently I've actually applied to step up. I've always wanted to do advanced practice. Never thought that I'd be able to do it at this early stage in my career. However, I've applied to go ahead and do that. And yeah, I can tell you great news that I got the job. So I am now a band 7 and will be a band 8A at the end of 2 years. I lead with care and compassion, and my team tell me so every day. So thank you very much to the care programme.
So you can see there that Jennifer's just mentioned that a few of the things that I've highlighted are that, you know, it was more than a leadership course. It had the resilience that she was looking for, and it confirmed the leadership, how leadership should be, with words like compassion. And it also, it's led to a career high. So Jennifer's been very busy, and she did present at our nursing awards, Greater Manchester Primary Care Nursing Awards, and did a fantastic job of it. Like I said, she's gone national with some stuff. Her own personal experiences as well, that's given her the confidence to approach, whereas she might not have had that confidence before, and it's furthered her career. So she's furthering her career all the time. So really positive. So I'll just go on to our next video, who is Catherine. So Catherine Akasile is a practice nurse. She's been a practice nurse for 14 months. She works in Tameside and Glossop at Horton Thornley Medical Centre. So if you just listen to what Catherine has to say.
My name is Catherine. I'm one of the participants on the CARE program. I did gain a lot from the CARE program, and it has enabled me to go from novice practitioner to a confident practitioner. I did the CARE program when I was just 3 months into practice nursing, and I've gained a lot of experience and it has helped me to develop my leadership skills and to be a good role model and to know that you can be a good leader without any drama. And it has empowered me to be able to know what I want to do with nursing and where I want to be in nursing, and that has helped me to be able to apply for the training advanced clinical practice, which I will be starting in September. Thank you.
And as we can see there from Catherine, Catherine's quite new, or what I would say is quite new to the system, but it's changed her from a nervous practitioner to quite a confident practitioner. It's helped her to develop her skills, and it's changed her mindset. So it's fantastic. And now she's going to be doing the advanced practitioner course. So fantastic stuff. Fantastic stuff. So again, we've got, just on our last video, we've got Jane Templeton, who's a practice nurse. Now, Jane's quite an experienced nurse. She's been qualified since 1985. She's been in primary care or a GPN nurse for 6 years, and she's from Tame Valley PCN, and that's Bridlington Surgery, Stockport.
My name is Jane, and I'm a general practice nurse working in the Greater Manchester area. Although I've been in nursing for 35 years, I've only been a general practice nurse for about 6 years. I felt like I'd got to the point where I came to work and did my job and went home, and there wasn't an awful lot in between. With the emergence of COVID, it allowed us to work across a PCN network to provide a successful vaccination programme. And this was great because it meant that ordinarily I wouldn't work or meet with other nurses and other health staff at the other practices in our PCN. So it was great to kind of network and really get to know people. Throughout this process, I became aware that everything that went on in the PCN was very practice manager and GP led, and I quickly realised that there was no nurse voice at all. So when I attended the CARE programme, I felt that they gave me the skills, empowered me to become that person, to have that voice. I work in quite a large nursing team at my practice, and there was nobody really that would ever speak up, any of the nurses, to actually give the nursing team a voice. So I feel that the skills that I learned throughout the CARE programme allowed me to do that. And I found that I was listened to, and I am listened to. I've completed some really successful projects since the CARE programme, and really focused on our the health of our population, of our patients, and have come up with the other nursing team with some really quite innovative ideas to engage our patients. I was also very lucky, since I did the CARE programme, to be nominated and to be successful to win the award for the General Practice Nurse of the Year, which was absolutely amazing. I find that I've got a newfound confidence. I enjoy my job a lot more, and it's made me become much more self-aware. So I'm really grateful that the CARE programme has given me the opportunity to be able to do this.
And again, really, really positive stuff. And again, just to highlight that the skills that she learned really developed her to be listened to and give her the confidence to actually go forward. Like she said, a lot of the voices for PCNs were for GP practice managers, and noticed there wasn't a nursing voice. And that's where Jane decided that she wanted to be that nursing voice. And she's led multiple successful programs through that, and it's given her a newfound confidence. And she actually, it's like a renewal of enjoying a job. So really, really impressive stuff from a personal point of view from the care program as well.
Okay, so back to me.
Thanks.
So thanks to those ladies, and I'm sure you'll agree what amazing inspirational nurses and fantastic testimonials for just taking part in this absolutely superb programme. Involved in the programme is a quality improvement project, and that brings you to the heart of population health in your area of work. And everybody that participates in the programme takes up a project, be that small, large, or ongoing or completed. They do take a project, and that takes their leadership development to a higher level and their voices to be heard. These are just some of the projects that you can see on here that have been ongoing through the time of the programme in 2021 and still are ongoing, I might add. So many of the projects were developed during COVID, as you're aware of, and they are continuing now. Some of them for community, and some of the population health impacts and benefits can be seen here. We've got specific diabetes target groups and group consultations in areas, to community health improvements through gardening projects, this connection for elderly frail adults in the community, and then there's those that are targeting specific areas of health inequality like cervical cytology in specific areas. So an absolutely fantastic array of various quality improvement projects that went on through the time. Next slide, please, Johnny. So I just want to say again, and go back to a slide we said before, what does CARE stand for? It stands for connected, authentic, resilient and empowered. And you've heard all those words from those testimonials here. And these now are those wider outcomes. What we were looking for in the beginning, why we took the offer up, was to extend the leadership roles, to support existing and potential nurse leaders to develop, to create potential by empowering and amplifying the voices of nurses. And look at this. This is just some of what we have. This sums it up perfectly. And you've heard from Jenny and Jane and Catherine about their development and how about their self-progression and how it's empowered and encouraged them. This slide shows more than that. This is fantastic. Just what these cohort of nurses have gone on to achieve, some exceptional outcomes from the programme in a really unsettling and challenging time, like Johnny said. What they've come through both personally for some of them and professionally, like many of us, we really do congratulate them for that. Some have been inspired and encouraged and moved to nurse director post, to primary care nurse lead post, which we set out our aim for, not 67, but we have them. We have nurse leaders out there, and that's just what we wanted. Some, like Jenny was said, have written articles for national journals, presented their project health improvement outcomes nationally and internationally. Some have starred in national conferences and local conferences and spoke about the CARE programme, and they've gone on to receive national awards and local awards, like Jane said earlier, as GPN of the Year for Greater Manchester. I think you'll agree we have some real superstars here in Greater Manchester in nursing, and some have gone further than that and have been given the Honourable Award of Queen's Nurse, which is absolutely fantastic. Next slide, please.
So you're probably wondering what next? So Greater Manchester are really, really proud to announce that we're fortunate to have secured funding for a further 90 places in 2022. We're working in partnership with Greater Manchester Primary Care Federation. The format will remain the same. So there'll be an 8-week programme. It's 4 hours commitment a week, and we're trying to respect school holidays, so there will be a break as well throughout those programmes. First cohort starts in October and the second cohort in January. But here's where we're being really ambitious. So there's 90 places in total. 30 will be offered to our primary and community nurses. So that's any of you that are here, a healthcare support worker, nurse associates, practice nurse, district nurses, right across Greater Manchester. With the 60 places being available to our allied health professionals working in clinical teams across primary and community settings. So that's our dental, pharmacy and optometry colleagues too. We'd encourage anybody who's interested to submit an expression of interest to our partner GM Federation. I'm just going to share with you kind of a flyer which we will share with the slides later today. The contact details at the bottom of this page. You can contact Kath Arrowsmith directly at the Federation if you want to hear some more. But we really hope that hearing from past candidates really provides that inspiration and motivation to consider the opportunity for yourself, for your team colleagues or people you work with. And I suppose the key question is, why do we want to replicate it? So since the 1st of July, we're an integrated care system. We aim to come together to plan and deliver joined up healthcare and improve the lives of people who live and work in Greater Manchester, and that includes our workforce. All our partners of our health economy have a role to play, and we want to create opportunities to ensure equity of access to programmes which develop and enhance our workforce, supporting the growth to tackle the complex challenges that we're faced with. I think you might hopefully have teased this out, kind of why is it needed? We know from workforce surveys, as you can see from the right-hand side, both nationally and locally, how people are feeling. The pressures and the asks placed upon our services are at a scale that really haven't been seen before. We all also see the unhelpful headlines and the public perception that's reported in the media, and all of that's really, really not very helpful. COVID did serve as a powerful blow to exacerbate people's feelings and the pressures that have been felt upon the services. And actually care emerged mid-COVID, and at a time when really we questioned, was it the right time? Was it a bit risky in terms of people being able to commit and the pressures that were in the system? But on the flip side of that, care really couldn't have come at a more important time. And we hope that you can see that this evaluation supports this. The presentation today and the feedback have been tremendous, and we really want you to experience that too. So my question to you is, do you want to feel empowered, energised and inspired? And if the answer is yes, absolutely. Or maybe you're even thinking, I'm not too sure, I don't know, have I got the time? Then what I'd say to you is your care starts with you. So just give it a go. Give care your time and your commitment. Give yourself the opportunity and see what happens. That's what a lot of the ladies did in 2021, and their outcomes were absolutely incredible. So we hope by extending the programme in 2022, we've given you inspiration and that you will consider this for yourself or your team. We're confident that you can achieve similar benefits to that of our 2021 programme participants, both professionally and personally. And we look forward to hopefully welcoming you onto the programme. Any questions?